Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And I've been doing a actual series on stigma, specifically social stigma, healthcare stigma. All of these I've been talking about, but in a systems-based approach. So now we're needing to build a framework that we can work off of, especially by creating and understanding what stigma actually means. So let's get started. This is actually an article that was published in 2018, and it's called Stigma in Health Facilities, Why It Matters and How We Can Change It. So as we go through this, they do mention some of the conditions, such as tuberculosis, diabetes, leprosy, or cancer. But however, addressing stigma experienced by health workers is important, and other types of groups. So this is part of the important portion of this is how do they define stigma. And so stigma is a powerful social process that is characterized by labeling, stereotyping, and separation, leading to status loss and discrimination, all occurring in the context of power. So this encompasses discrimination as well, and this was defined by the Joint United Nations Program on HIV/AIDS, UNAIDS, and showing that unfair and unjust action towards an individual or group on the basis of real or perceived status or attributes, socioeconomic status, gender, race, sexual identity, or age. So these are areas that can cause stigmatization, and that's because health condition related stigma is stigma related to living with a specific disease or health condition. So here's a little bit more about health facilities actually having verbal abuse and in some cases physical abuse, and as a result, stigma is a barrier to care for people seeking services for disease prevention. And so they're saying that in health facilities in particular, particularly egregious, negatively affecting people seeking services at a time when they are most vulnerable. So this goes through and talks about stigma a little bit more and how it's experienced among healthcare workers, and then also putting in the case with stigma drivers. And there's a really nice chart that's been created, which we could look at in a bit, but talks about what are the areas of stigma, what are the main areas of stigma. It's leprosy, mental illness, epilepsy, which I happen to have, disability, and HIV. So these are, in many cases, clients might experience more than one type of stigma. So substance abuse is a source, MI, myocardial infarction, tuberculosis, HIV, diabetes, leprosy, and cancer. Having a negative sort of attitude, and particularly the culpability for the condition. The specificity of the driver's manifestations and the consequences mechanisms are available. So here's the method that they use for screening, and did a quick abstraction. Here you can tell which of the records were excluded, duplicates were excluded. This is a Prisma flow diagram, which if you're interested in learning about Prisma, that's a great one. So n equals 42 was the summary characteristics, and there was some of this was in a quasi-experimental sort of status. So how many summary of intervention characteristics. So where, who region it came from, wealth of country, evaluation method. So all of these were kind of classified. And based on that, there were conclusions drawn. So I'm going to turn us back to the main article. Stigma reduction approaches utilized in identified interventions. So provision of information consisted of teaching participants about the condition itself, or about stigma, its manifestations, and its effect on health. Skills building activities. These involve creating opportunities for healthcare providers to develop the appropriate skills to work directly with the stigmatized group. So provision of information, skills building activities, participatory learning, contact with stigmatized groups, so showing deep sympathy, humanize the stigmatized individual, and break down stereotypes. And then to empower, this approach is to improve client coping mechanisms to overcome stigma. And then structural or policy change approaches include changing policies, providing clinical materials, and redress systems and facility restructuring. Again, at N equals 24, nearly every intervention took multiple approaches, and these are some direction, some information that can be gleaned from this. So let's take a look at an information-based approach by disease, MI, substance use, and some people had both, so it's good to look at. And then how the approaches are delivered. Table 4 is intervention methods by approach, and this is good to kind of briefly glance at, not too much going on there. So, stigma drivers, targeted interventions, these are what this is now getting into, and bringing healthcare workers and clients together for stigma reduction specifically is important. But before you do that, you actually have to describe the stigma and understand where stigma comes from. So, being facility-based champion teams of health facility workers and clients who develop and lead tailored stigma reduction efforts in the facilities. So this is, in every facet, this is something good to be, as they end with, ever-growing scientific evidence builds, prevalence of stigma in health facilities can then, and its negative impact can then make things better. Relatively few interventions exist to address the major impediment in healthcare, like stigma. So this just shows that not only a broad-based intervention is needed, but also targeted, like tuberculosis or diabetes, and all of the conditions that we went over. Remember, even epilepsy was included in that. So this is kind of recommendations and future priorities. Prioritize stigma, rigorous evaluation, standardize stigma measures to facilitate comparisons. Study the scale-up and routinization of stigma reduction in health facilities. Capture cost data on the interventions and include cost-effectiveness analysis. And then develop and test stigma reduction interventions tailored to this local context and culture. And it goes into a little bit more. Then mental illness, going over tuberculosis. And Lincoln Pillan, this article, Conceptualizing Stigma, is often cited in stigma research. So I wanted to share with you this article. I want to make sure we went over everything. And if you want to look further into this article, I encourage you to do so. The name is Stigma in Health Facilities, Why It Matters, and How We Can Change. Thank you for listening.